Hi, my name is Angelica Enzueto. I'm a student at Excelsior University. I'm here to do my assignment for Module 8. So, working in a community healthcare setting, it is imperative as nurses to obtain as much information from the patient in order to provide continuous care and to close any loops. Our focus for all patients is to bring awareness to their health and well-being, but many of the patients that I have come across have undiagnosed chronic illnesses because they're underinsured. One patient that comes to mind was a 35-year-old male who came in complaining of erectile dysfunction. This client expressed his concerns of unable to maintain an erection and complained about his weight. For all clients, we obtained a urine sample. Urine analysis was positive for glucose in the urine. This led to an order for an in-office hemoglobin A1C once I shared the results with the provider. The A1C was so high that the machine couldn't read it. It was apparent that the appointment was no longer going to be about the erectile dysfunction because he had bigger problems that was affecting his intimacy. The provider explained to the patient that he is likely to have diabetes, which is causing or resulting his erectile dysfunction. I recall the patient's behavior as cheerful and nonchalant about the diagnosis. It was difficult to interpret if he knew the seriousness of the new chronic illness. The next appointment, the patient had returned with resulted outpatient labs confirming the diabetes. During that time, the provider explained to the patient of the new diagnosis and the treatment plan. I went back to reinforce the teaching. The patient expressed interest in controlling his diabetes. As the prospective nurse, I would use the nursing diagnosis readiness to enhance health management as evidenced by patient verbalizing, "I want to get my health on track." A patient outcome that I would want him to meet is the patient would describe 5 points he would integrate into his therapeutic regimen into daily living by his next follow-up appointment in 3 months. During that time, we reviewed how he would be checking his blood sugar and how often. I know that and know what his desired blood sugar range is. We reviewed his daily medications that manage his diabetes, how to take the medication, made a referral and appointment with the nutritionist for a diabetic diet and for him to learn how to count carbs. We discussed ways to incorporate 150 minutes of a week of moderate activity, and lastly, daily foot checks. Always wear slippers or shoes when walking, no more walking barefoot. At the end of the visit, the patient was able to teach back the information that he learned. I think the discussions and reflections helped me apply the nursing process on the given assignments. I felt that the grading rubrics helped me meet its expectations for the class and for all the courses. But I do think that the discussions should explicitly say to use or apply nursing process and use clinical judgment when answering the questions, just to help reinforce a new way of thinking and help critically think as we're completing the assignments. Thank you so much.